Hi, I'm Jo Smethurst, a Senior Engagement Advisor at Health Consumers Queensland, and this short presentation is to talk about Health Consumers Collaborative of Queensland. I'd like to acknowledge the traditional owners of the country where I am. I'm on Turrbal and Yagara country. This presentation is to talk about what is the collaborative, a brief overview of the terms of reference, and giving you a brief history and context of where it sits in health in Queensland. So it's the collaborative, we affectionately call it the collaborative, is actually the Health Consumers Collaborative of Queensland. It was established in 2016 and consumers serve 2-year terms and for a maximum period of 2 terms of 2 years. The collaborative is a HCQ deliverable with the funding we receive from Queensland Health. It's also very unique. It's the only mechanism that brings strategic consumers together across the state with leaders in the health system. And we're really proud that it is independent, but it's also integrated in QH governance, which I'll show you at the end of this short presentation. Members include consumers, Deputy Directors General within the Department of Health, a representative of the Health Service Chief Executives, a representative of the Board Chairs Forum, the Chair of the Queensland Clinical Senate, a representative from the Queensland Clinical Networks Executive, and a Primary Health Network rep, as well as key people within Health Consumers Queensland. It's typically been chaired by the Chair of Health Consumers Queensland, and the Chief Executive of HCQ plays a key role as well. The goal of the collaborative is to ensure consumers, carers and their families are at the centre of all decision making and to build a more consumer-centred health system here in Queensland. It does this by being an advisory group and a forum for health consumer issues. It's an opportunity for senior leaders in health to listen to and learn from you, our health consumers, who are using the system daily, weekly, monthly, and are really understanding what the needs of your communities are. It's a mechanism for health leaders to get consumer and carer feedback on policies, ideas, strategies, and programs and projects of work really early in their infancy, really early phases of planning. And the collaborative may initiate and recommend initiatives that will promote a more consumer-centred health system. Before COVID, the collaborative would work up a 12-month plan and discuss a key topic. So in the past, value-based healthcare was discussed, the intersection between disability and health literacy. During COVID, we adapted things pretty quickly and on the fly. We wanted to be responsive and we wanted to be talking about things that mattered to both consumers in Queensland and to the health leaders who were trying to make sure that health could respond to COVID in a real and meaningful way. And right now we're probably at that stage where we need to balance having a 12-month longer term plan along with how do we remain responsive to what's going on with the pressures in health in Queensland at the moment. And finally, the Health Consumers Collaborative of Queensland has a role in the systems governance of Queensland Health. You can see here on the left-hand slide of this, this is a Department of Health slide, and so we're really proud that the collaborative has a role within the wider context of Queensland Health System governance and that you will play a key role in this. Thank you for your time.